students who would like to be an emergency doctor in the future, I would advise them that they must be mentally prepared to be able to work in shifts. The shifts can be rather long, as long as 24 hours, and even during public holidays and weekends. We must also be able to work fast, as the workload is pretty high, and sometimes you have to handle a few emergency cases at one time. For AD doctors, there's no need to be trained surgically. We only need to do certain minor procedures like stitching up wounds, putting in tubes in the body, and managing damaged nails. The commitment level for medical students is rather tough. We studied for long hours, then there are many books to memorize, many facts to memorize. We need to go to the wards. After the years of basic science, that means usually year 4 to year 5, need to be attached to the medical wards as well. They also help out in caring for patients with the hospital doctors. As a resident doctor, the commitment level is basically to fulfill working hours per week. We work about 50 hours per week, and as I mentioned before, we work in shifts, and we need to clear the cases. As a specialist, the commitment level is of different nature. Their workload is not as high as resident doctors, but they manage higher level and more difficult level of cases and more complicated cases. To be a specialist, they also need to go through interview after they complete their hospital training, and they need to work under a senior consultant for years before they pass their postgraduate exam. Even during my time, which is about 20 years ago, getting into medical school is not easy. I'm sure it's more difficult now. Same, we have to go through medical interview, and you have to impress the panel of professors. I still can remember one of my friends showed them a photo of him at the peak of Mount Everest, and he got through. To cope with the unfortunate passing of a patient after hours of trying to save him back to life, and to deliver the bad news to their anxious family members waiting outside the research room, is very heartbreaking. We pray for them, but at the same time we need to be strong, because we need to continue to help other patients without faltering. It can be quite stressful handling emergency cases on a day-to-day basis, with patients screaming in pain, family members breathing down your neck to ask for diagnosis and proper treatment. One of the most shocking cases I can remember was that a man who came in and frantically moving all his limbs and shouting, and we didn't know what was the cause. We had to tie him down and then give him a sedation. During the struggle, he kicked one of the nurses' wrist, and the nurse had to go for an operation after that. So we got to be mentally prepared for such unexpected scenarios. The unique nature of any work is that we require a lot of teamwork. We work together as a team between nurses and fellow doctors. And through this teamwork, we solve a lot of difficult situations, and this reaffirmed my decision to be an A&E doctor. For physicians to cope with a proper work-life balance is not easy, because a lot of hours are put into our work. And for medical specialists, very often they need to go back to the hospital to look after their patients. For example, obstetricians, cardiologists, whenever they are needed, they need to go back. But it's important to have a proper work-life balance, because this will prevent burnout. Burnout is very common. not only in Singapore, but also in overseas like in the US. We would like to, I like to look for something that can relax my mind, body, like photography, and pursue anything you deem as relaxing to you. For those of you who want to be doctors, medicine is a very meaningful job, despite the risks and hardships, because we gain satisfaction by helping people and shaping their lives. With our aging population, we need more and more doctors and healthcare workers. I wish you all the best.